Hello, my name is Juan Bruno, and I'm going to be your student nurse for today. Is it okay if I perform a head-to-toe assessment on you?
Yes.
Okay. Can you please verify your name and date of birth?
Daniela Santos, January 15, 1999.
Okay. Now I would wash my hands for 20 seconds to provide privacy for my patient. All vital signs have been taken. All vital signs are within normal limits. And now I'm going to ask you 2 questions to make sure patient is alert and oriented. What year are we in?
2020,
And do you know where you're at?
at a friend's house.
Okay. Patient is alert, oriented to person, place, and time. And in this case, now when we start, I would put on gloves just in case we encounter any bodily fluids. So now we're going to start with skin assessment. Patient's skin tone is evenly throughout the upper and lower extremities. Patient has an undertone, a yellow undertone. Skin appears to be smooth. I don't visualize any swelling, any edema, any bruises, any lesions, any rashes. And now we're going to move on to the palpation of the skin. And palpation of the lower extremities. Skin is dry and warm to touch. There's no signs of any edema, and we're going to check turgor. Okay, patient's turgor is good. No signs of any dehydration. Okay, can I please see your hands? Yellow. Okay. Nails are slightly curved and rounded throughout the fingers. There is a yellowish undertone. Surface is smooth, and there's no signs of clubbing or any brittleness. Now I'm going to assess her head, face, and ears. Head appears to be symmetrical. Hair is clean and shiny. Maybe a little bit of dandruff. There is no visual lesions. Now I'm going to palpate the head. Can you please let me know if you feel any pain or tenderness? Any pain or tenderness? Okay, nice. There were no bumps or lesions or pain or tenderness on the scalp. The hair is thick. Now I'm going to move on to the facial expressions. Eyes are symmetrical and the nose is midline. Can you please smile? And can you please raise your eyebrows? Okay, cranial nerve number 7, which is facial expression, is intact. Facial movements are coordinated. I will now press on her face to check for any sinuses. First, we're going to start by the frontal. Any tenderness?
No.
Then we're going to move over to the maxillary. Any tenderness? No signs of pain or tenderness in the sinuses. Okay, now we're going to place our finger in the temporal mandibular joint to assess for cranial nerve number 5, which is the trigeminal nerve. Can you please open your mouth? Okay. Cranial nerve number 5 is intact. Now I'm going to start with the ear assessment. Ears appear to be symmetrical. The skin color is consistent with the face. There's no swelling, redness, or discharge on the ear. Now I'm going to assess for any pain on the ear. I'm going to push up the pinna and tragus. Let me know if you have any pain. Okay, now to the other ear.
No.
Okay. The ear feels firm and there's no pain. Now I'll be stepping behind her to perform the whisper test, and she's going to tell me what I told her.
5, 6, 7, 10, 11, 12.
Perfect. Patient's hearing and cranial nerve number 8 is intact, which is the vestibulocochlear nerve. Now we're gonna head over to assess the eyes. The eyelids are intact with no redness, swelling, discharge, or lesion. Eyelashes are evenly distributed, and the sclera is white. Can you please pull down your eyelids? Okay. The conjunctiva is pink and moist. At this point, I would use the Sentinel chart to measure visual acuity and cranial nerve number 2, the optic nerve. Alright, and now I'm going to use my pen light. Now I want you to follow the pen light as I go in. Okay, pupils are equal round, reactive to light, and accommodate. This is also known as perla. The cranial nerve number 3, which is the ocular motor, is intact. Now I'm going to continue with the pen light, and we're going to do the parallel tracking as we go. Now we're going to start here. Look without moving your head. Cranial nerve number 3, cranial nerve number 6, cranial nerve number 4, cranial nerve number 3, cranial nerve number 6, cranial nerve number 3. Perfect. So cranial nerves number 3, 4, and 6 are intact. Cranial nerve number 3, which is ocular motor. Cranial nerve number 4, which is SO4, the superior oblique. And cranial nerve number 6, which is LR6, which is the lateral rectus, are intact. Alright, now we're also going to check for our corneal red light reflex. We're going to put the light 12 inches. Okay, perfect. Both corneal red light reflex are on the same location on both eyes. Now I'm going to check each pupil penetration. Perfect. Perfect. Both pupils react briskly to direct and consequential light. Now can you please lift up your head because I'm going to check your ears. Okay. Perfect. Nose is intact, internal nares are intact. The nose is symmetrically and is midline. There is no signs of congestion or swelling in the internal nares, and there is no drainage found. Now I will palpate to assess for the patency of the nares. Can you please puncture each nair to make sure for patency? Breathe in and out. Okay, perfect. If I was in the clinical setting, I would grab an alcohol swab to make sure the patient has her cranial nerve number 1, which is the olfactory, intact. Now we will start by inspecting the mouth. Patient's lips are pink with a little bit of cracking. There's no lesions or bruises. And now can you please open your mouth so I can check? Okay. Perfect. The teeth are present, white and clean. The oral mucosa and throat are pink and moist. Her tonsils are a +1. And now I'm going to assess for cranial nerve number 12. Can you please stick out your tongue? Move it left and right and up and down. Perfect. Her cranial nerve number 12, which is the hypoglossum, is intact. Now can you please open your mouth one more time and say ah? Say ah. Okay. Cranial nerve number 9, which is the glossopharyngeal, and cranial nerve number 10, which is the vagus, are intact. Now we're going to start palpating her lymph nodes. She's going to let me know if there's any tenderness or pain. First, we're going to start with the preauricular. Any pain?
No.
And then go over to the posterior auricular. Any pain?
No.
Now we're going to head over to the occipital. Any pain? Now we're going to move up to the submental. Any pain?
No.
We're going to go over to the submandibular. Any pain? Now we're going to go to the jugular digastric. Any pain? And we're going to head over to the superficial cervical. Now we're going to head over to the deep cervical. Any pain? Posterior cervical. Any pain? And we're going to finish off with the supraclavicular. Any pain? Okay. So now we're going to assess for cranial nerve number 11, which is the accessory muscle. Can you please shrug your shoulders? Okay. Now we're going to provide some. Perfect. Alright, cranial nerve number 11, accessory muscle is intact. Now we're gonna head over to palpate the trachea from the front, make sure there's no deviations. Okay, trachea is intact, there's no deviations. The trachea is midline. Now we're gonna check for any presence of any jugular vein distension. In a clinical setting, we would lay the patient in a supine position, and then we'll work ourselves up by elevating the bed to 30 to 45 degrees. Please tilt your head. Okay. Okay, perfect. No signs of jugular vein distension. All right, now we're gonna palpate and auscultate the carotids. Okay. Okay, pulse is at a 2 positive, normal. Now we're gonna check for any druids, the carotids, with the belt. Okay. Okay, no druids present. Now we're going to start by inspecting the posterior and anterior aspect of the thoracic cage. Can you please rotate yourself? Posterior scapular movements are symmetrical, respirations are normal. The patient has an anterior-posterior of 1:2 ratio. Now I'm going to palpate the posterior to check for any body masses or crepitus. No body masses or crepitus found. Now we're going to check for chest expansion. You please breathe in and out. One more time. Chest expansion is normal. Now we'll percuss the posterior aspect of the thoracic cage. Okay, now we heard the normal resonant sound, and now we're gonna finish it off by auscultating her posterior aspect of the thoracic cage with the diaphragm. Breathe in and out. Okay. 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 Perfect. No sounds of any wheezels or crackles in the lungs. In clinical rotation, I would remove the gown and perform scope to skin. Okay, now we're going to move over to the anterior aspect of the thoracic cage. There's symmetrical rise and fall of the chest. There's normal respirations. There is no labored breathing. And now we're going to move on to the auscultation of the lungs and the anterior portion. Breathe in. Breathe in. Breathe in. Inside. Breathe in. Like that. Okay. The lungs are clear. There's no signs of wheezing or crackles. And now we're going to move over to inspect and palpate the chest for any hives or lifts. So first we're gonna start palpating the chest. There's no signs of hives or lifts. Now I'm gonna touch your chest now to check for your apical pulse, which is in the 5th intercostal space, mid-clavicular line. Okay. Now I'm gonna check for capillary refill on both fingers and toes. Okay. Over the fingers. Okay, capillary refill are below 3 seconds. Now I'm gonna check for the pulse, which is gonna include the carotid, the radial, the dorsal pedis, and the posterior tibialis. All right, carotid pulse, head right here. Okay, other side. Okay, now the radial. Now please grab your hands. Okay. Now the dorsal pedis. Okay. Now the posterior tibialis. Okay, for the other foot. Dorsal pedis. The posterior tibialis. Okay, perfect. Pulses are 2 positive. They're normal, and they're symmetrically in rhythm. Okay, now we're going to start by auscultating the heart valves, and we're going to listen to S1 and S2. First off, we're going to start with the aortic valve, which is located on the right side of the sternum in the 2nd intercostal space. Okay, now we're going to move on to the pulmonic valve, which is where you best hear S2. It's located in the 2nd intercostal space, left side of the sternum. Okay, now we're going to move down to the 3rd intercostal space, which is where you hear the Erb's point. Now we're going to move on to the tricuspid valve, which is heard in the 4th intercostal space. And lastly, we're going to move on to the mitral valve, which is heard in the 5th intercostal space, mid-clavicular line. The mitral valve, also known as your apical pulse, is where you hear S1, and it's used when there's any abnormalities. We assess for a full minute. In this case, there were no abnormalities, so we would just use pulse and we'll multiply times 2. Now we're going to check if there's any S3, S4 murmurs with the bell of the stethoscope. Okay, everything is normal. There's no sound of any S3, S4 murmurs. Okay, now I'm going to start with the abdominal assessment. But first, we're gonna start with a couple questions. When was your last bowel movement?
Spring.
Do you have any pain or tenderness in the abdominal area? When was the last time you voided?
A couple hours ago.
Okay. Now we're gonna start with the inspection of the abdomen. Can you please get up? Her skin is smooth. There's no signs of skin breakdown. The skin is even colored. There's no redness. The abdomen is flat and symmetrical. There is no distension, bulging, or pulsations. The umbilicus is midline. And now we're going to move on to the auscultation. Okay, we started at the right lower quadrant and we worked around the umbilicus. There is active bowel sounds throughout all 4 quadrants. And now we're going to move on to auscultate for any bruits of the aorta, renal arteries, and the celiac and femoral arteries. And the femoral artery is in the inguinum. There is no signs of any bruits. Pulsations were positive too. And now we're gonna head over and percuss the abdomen. We heard tympanic sound throughout all 4 quadrants, no donut sounds. And now we're gonna head over to the palpation. First, we're gonna start lightly and then we're gonna move in deeply. Let me know if you feel any pain or tenderness. Okay, now we're gonna start deeper. Any pain or tenderness? No pain or tenderness throughout all 4 quadrants. Okay, now we're gonna inspect joint and skin. Okay. Joints are symmetrical and equal in size. Skin color is even, and there's no signs of swelling, edema, drainage, bruises, or scarring. Now we're gonna move on to the range of motion. And first, can you stand in front of me, please? Now we're gonna start with abduction. Abduction, so you open your arms. Then adduction. And now we're gonna add some resistance. Okay, perfect. Now, adduction. Okay. Now we're gonna do flexion and extension. Flexion and extension. Now we're gonna add some resistance. Out. Okay. Now can you please elevate your arms and depress. And then now we're gonna add some resistance. Okay. Perfect. Can you perform pronation and supination? Pronation, supination. Now with some resistance. Perfect. Can you squeeze my fingers as hard as you can? Okay, good. Now we're gonna perform abduction and adduction with your legs. Just like this. Okay, now with some resistance. Okay. Okay, now the other leg. Okay, perfect. Now can you sit down and do flexion and extension? Flexion, extension, okay, some resistance. Perfect. Okay, Patient's range of motion for upper and lower extremities are 5 positive. Okay, now I'm gonna be ending my assessment with the neurological assessment. We will be testing for the stereogenesis and the graphiothesia. I'm gonna ask my patient to close her eyes. I'm gonna hand her an object and she's gonna say what it is. Sunlight? Okay, nice, good. Now I will be writing a number on her hand and she would tell me what it is.
Number 8.
Okay, perfect. Patient's neurological assessment went well. All cranial nerves have been performed throughout the assessment. All cranial nerves are intact. This will be ending my assessment. Thank you. Thank you.